возрастного дисциплинарного инструкционного фака. А вы на работе уже? Нет? Да я лекцию начала, и я сейчас стала с телефона проверять. У меня как бы нету, ну, экран черный, то есть нет видимости то, что я транслирую на экране. Угу. Алло? Да, хорошо. Спасибо. Студенты заходят и выходят, я сижу.
Так. Пойдем. Такое иногда бывает.
Все, благодарю. Good morning, students. Good morning or good day. It depends on when you will watch this lecture. Today we are having Immunology lecture number 4. Today we will talk about one of the most interesting theme in immunology. Today we are going to discuss hypersensitivity. Another name of this state of human organism is allergy. And in the end of this lecture, in the another part of this lecture, we will talk about immunological memory and immunological tolerance. Firstly, I want to remind you that in our organism, there are some types of immune response. In other words, how our immune system responds to antigen. There are normal types of immune response, for example, phagocytosis, it's activation of phagocytes, antibody production, immunological memory, which we will discuss today. And there is another type of immune response, it's hypersensitivity or allergy. Hypersensitivity or allergy is abnormal type of immune response. It is immunopathology. It is pathology of immune system. Pathology of immune system. Firstly, let's talk about hypersensitivity. What is it? About definition of hypersensitivity, about allergy, and about stages of allergic reaction. At first, we should say that hypersensitivity is a state of altered reactivity in which the body reacts with an exaggerated immune response to a foreign agent. It is state of altered reactivity or hyperreactivity when body reacts with an exaggerated is abnormal immune response to a foreign agent. And you remember from the previous class that antigen that cause allergy is called allergen. Allergens, antigens that cause allergy. There are different types of allergic reactions, different types of allergic reactions. We will talk about them, but these allergic reactions have the same mechanism, and we can talk about stages of allergic reaction. Any allergic reaction has 3 stages in its mechanism, in its development. The first stage is immunological stage. This stage develops after the first contact of organism with an allergen. After the first contact, when organism of the person contacts with allergen at first time, in the childhood, for example, or in the adulthood. The first contact with allergen causes activation of immune cells. Activation of immune cells, basophils or mast cells or T helpers, and activation of immune cells leads to synthesis of antibodies. Synthesis of antibodies. For example, it's in immediate type of hypersensitivity, ITH, immediate type of hypersensitivity. In delayed type of hypersensitivity, DTH, antibodies don't take part, so there we can observe sensitization of T helpers. So immunological stage develops after the first contact, cause activation of immune cells, production of antibodies, and sensitization of immune cells. The person can live with this state, with activated immune cells, and some of them don't know about circulating antibodies. I hope you remember which antibodies take part in allergy. These are IgE. IgM, IgG, and IgA don't take part in allergy, just IgE. Then, the second stage is pathochemical stage. Pathochemical stage develops when activated mast cells and basophils secrete mediators. When does it happen? When allergen enters the human organism once more. So pathochemical stage always develops just only after immunological stage. Because we have said about activation of immune cells, these are mast cells and basophils. Activated mast cells and basophils circulate in bloodstream after immunological stage. In every following entry of allergy in human organism, activated mast cells and basophils produce mediators. What are these mediators? These are histamine, heparin, and other inflammatory substances. It's in immediate hypersensitivity. In delayed hypersensitivity, activated T helpers secrete pro-inflammatory cytokines, interleukin-2, interferon gamma, and tumor necrosis factor. So pathochemical includes production of chemical substances, of mediators of allergy or cytokines. And then pathophysiological stage, means clinical display of allergic reaction that caused by the effect of mediators, heparin, histamine, serotonin, and activated immune cells. What are clinical manifestations of allergy? It can be rash, itching, swelling, inflammation, and tissue damage. Once more, about mechanism of development of allergic reaction. When allergen enters the human organism, at first time, in the first contact with the immune system, it causes activation of specific immunocompetent cells, basophils and mast cells, for example, or T helpers in delayed type hypersensitivity. Then, these activated immune cells produce specific antibodies, Ige. It causes sensitization. Sensitization, it is a state of human organism when organism is sensitized by the presence of Ige. Ige circulate in the bloodstream, and they bind with basophils and mast cells in the second contact with immune cells. At the second contact of the allergen with immune system, we can see clinical symptoms. These are visible allergic reaction. I have said about itching, swelling, rash, bronchial disorders. So clinical symptoms of allergy are visible just after the second contact with the allergen. It is impossible to see clinical symptoms in the first contact with the allergen because it's just immunological stage. So, let's talk about classification of allergies. I have just started to talk about immediate and delayed type of hypersensitivity. Actually, we classify hypersensitivity into two big groups, immediate type of hypersensitivity and delayed type. Immediate and delayed. They are classified in accordance to the timing of development. Timing. Immediate develops immediately, delayed develops after some time. Immediate type of hypersensitivity includes three types. It is type 1, that is called anaphylactic allergy or anaphylactic reactions. Type 2 is called cytotoxic reactions. Type 3 is called immune complex reaction. Please, you must know names of these types. It is necessary, it's important. And type 4 belongs to delayed type of hypersensitivity. It is called cell-mediated. What are differences? What are differences between immediate type of hypersensitivity and delayed type hypersensitivity? The first, the second, and the third types of allergic reactions are immediate type hypersensitivity. Reactions usually take from some minutes to some hours from the time of exposure to allergen. For example, in the first type, in type 1 anaphylaxis, it takes about from 2 up to 10 minutes after exposure of allergen. Immediate type hypersensitivity reactions are mediated by immunoglobulins. Ige, for example, in type 1, IgG in type 2, for example. Delayed type of hypersensitivity is called delayed because the reaction usually takes more time, from 24 up to 48 hours and even more from the time of exposure to the allergen. This is the fourth type of hypersensitivity, or it is so-called cell-mediated type. Delayed type of hypersensitivity is not mediated by immunoglobulins. It is mediated by cells. That's why it is called cell-mediated. Cells. Which cells? By T lymphocytes, T cells, monocytes or macrophages. Monocytes or macrophages. So let's talk about the first one, about type 1 of immediate hypersensitivity reaction, about anaphylaxis. Anaphylactic reaction, remember type 1, anaphylactic. Type 1 anaphylactic reactions occur within minutes from 2 up to 10 minutes of exposure to antigen, allergen. What happens? Allergen, when enters the human organism, combines with Ig antibodies. Some minutes ago, I have said to you that the first contact with allergen causes activation of immune cells and production of Ig. So, in the patient's organism, Ig circulate in the bloodstream. So, when allergen enters the human organism, the second time and every the following time, it combines with Ig circulating in the bloodstream. Ig binds to mast cells and basophils. Look here, these are Ig, this is basophils or mast cells, causing them to undergo degranulation, or it is release several mediators. Degranulation occurs in basophils and mast cells. I remind you that mast cells are present in tissues. Basophils circulate in in the bloodstream. Which mediators? Look here. Look at this picture, at this diagram. Mediators are secreted by basophils or mast cells. What are these mediators? These are histamine. What is the action of histamine? Histamine dilates and increases permeability of blood vessels. That's why we can see such clinical signs, clinical symptoms of allergy as swelling of tissues, and redness of the skin. Histamine increases mucus secretion of fluid from mucus, so in the patient we can see runny nose. And histamine also causes smooth muscle contraction in bronchi. So it causes bronchial constriction and disorders in respiration. The another mediator that is produced is prostaglandin. It causes contraction of smooth muscle of respiratory system and increased mucus secretion like histamine. And leukotrienes that are also produced by basophils and mast cells cause bronchial spasm of bronchus. Let's look at this scheme. It is scheme of anaphylactic type of hypersensitivity, type 1. In the left part of this scheme you can see sensitization stage or immunological stage. In the second, in the right part, you can see what happens in subsequent exposure to allergen. Let's look once more. I have just explained it, and once more. Allergen enters the human organism at first time, enters the lymphatic system, and B cells are activated that proliferate into plasma cells and produce Ige. Ige circulate in the bloodstream of the human during all the life, and when this antigen enters the human organism once more, they combine with Ige combine with mast cells and basophils and activated, and it causes activation causes degranulation of mediators that include, for example, histamine, prostaglandin, serotonin, heparin, and we can see clinical symptoms: redness, itching of skin, eyes, runny nose, bronchial spasms. Mediators that are produced in anaphylactic hypersensitivity can be divided into primary mediators and secondary mediators. Primary mediators are always present in mast cells in granules. They include histamine, serotonin, and heparin. Secondary mediators are produced later, and they include, for example, arachidonic acid metabolites, and it is known that secondary mediators are more effective than primary mediators. They cause a more severe effect than primary mediators. Which clinical manifestations can be visible in anaphylactic allergy? There are two types of clinical manifestations. The first one is localized anaphylaxis, or it is also called atopy. What is atopy? Atopy is a genetically mediated predisposition to an excessive Ig production. Genetically mediated predisposition. It means that in some humans, in some patients, there are genes that provide hyperproduction, that express hyperproduction of IgE. This we know these genes maybe are inherited from parents to the children. People can live with these genes of atopy, genes that provide Ig production during all their life, but without clinical symptoms of allergy. But in some patients, these genes are activated and they provide a hyperproduction of IgE. So what are visible manifestations of atopy, localized anaphylaxis? It is a cutaneous anaphylaxis when we can see urticaria, I will show in the next picture. Allergic rhinitis, runny nose, food allergies, atopic dermatitis or allergic eczema, and bronchial asthma. Let's look at these photos. In this photo, you can see clinical manifestation of urticaria. It is manifested in redness, like redness and rash. Urticaria is clinical manifestation of anaphylaxis, localized anaphylaxis. Localized means in the skin. Atopic dermatitis or allergic eczema is also clinical manifestation of anaphylaxis allergy after contact with allergen. I remind you that these symptoms, urticaria, atopic dermatitis, then runny nose, itching, these clinical manifestations are visible during some minutes, from 2 up to 10 minutes after exposure to allergen. We have just said about localized anaphylaxis that occur in nose, for example, in the skin. Another one is systemic anaphylaxis. It is the worst case of anaphylactic reaction of the first type of allergy. It occurs it occurs as a result of mast cell degranulation all over the body, and it can lead to anaphylactic shock. There are 3 potentially fatal reactions of anaphylactic shock. The first one is laryngeal edema that leads to fluid leaking out from tissues and swelling of tissues and organs. The another one is bronchial constriction that leads to suffocation. And the third one is peripheral edema that leads to shock from fluid loss. Anaphylactic shock. Anaphylactic shock occurs when mast cells and basophils release a great amount of mediators at one time, at one moment. Anaphylaxis is the severe degree of anaphylactic allergic reaction that is rapid in onset and may cause death of the patient. And the mediators affect shock organs. What are these organs? These are the human organs which are affected when the anaphylactic allergic reaction develops. They include arterioles and bronchi. Mediators cause capillary dilation, smooth muscle contraction, in bronchus, for example, and airway constriction. The pathological reactions which can lead to systemic anaphylaxis and death because of airway constriction. It can cause death of the patient during some minutes. Anaphylactic shock is a very dangerous state of allergy. How to diagnose anaphylactic allergy? There are two methods to diagnose anaphylactic allergy. The first one is a skin test. When we drop small doses of allergen on the forearm, on the skin, and after some minutes we can see a wheal or a flare or redness. It means state of allergy or anaphylaxis to this allergen, to grass, for example, like here. Another method is measure of Ige levels. Actually, I say to you that in organism of healthy patients who are not suffered from allergy, Ige is not detected, or is detected in a very tiny amount. Mostly it is absent at all. So Ige is an indicator, is criteria for allergy detection. So how to treat hypersensitivity, and how to prevent hypersensitivity type 1. The most effective way, it is full avoiding of allergen, because the reactions can get worse each time. For example, if patient knows that he has a food allergy to eggs or milk, this patient don't eat eggs and don't drink milk. The second one, this is using of antihistamine drugs. But you should remember that these drugs are effective just on the first phase, when histamine is released from basophils and mast cells. It is not so effective in the second stage, because when histamine is present in large amount. Antihistamine drugs block histamine synthesis, block basophils and mast cells. These drugs include such as loratadine, for example, claritine, desloratadine drugs, for example, Clarinex, and cetirizine, for example, Zyrtec. These are antihistamine drugs that are known for everyone who has allergy. Another group of drugs that are used to block allergy, to stop allergy, are corticosteroids. They also block histamine synthesis, and they block histamine action, so they can be used in late phase of anaphylactic reaction. They include prednisolone and cortisone. So in severe anaphylaxis, the first aid for the patient who has anaphylactic shock is injection of corticosteroids, prednisolone or cortisone. And sometimes it's necessary. Sometimes it's necessary in the most severe cases, injection of adrenaline. Adrenaline is the best immediate treatment for anaphylactic shock, that reverses effect of granules. Vasoconstriction relaxes muscles. It has quick acting but short duration. Once more, in the most severe anaphylaxis, we should inject both prednisolone with adrenaline. Another type of anaphylactic reaction is a type 2. It is cytotoxic. It is also immediate type. Cytotoxic reaction involve activation of complement by IgG or IgM binding to an antigenic cell. Once more, what is complement? I hope you remember that is plasma proteins of human blood that are present in non-active form and activated in the presence of the antigen. Here we should remember what is action, what are functions of complement. We discussed it in lecture number 2. You remember that functions of complement, the main function of complement is cytolysis. Cytolysis that is mediated by membrane attack complex. You remember what is it? Yes, it is C6, C7, C8, C9 components. So how does cytotoxic hypersensitivity develop? IgM or IgG bind with antigen, with allergen. It activates complement. You remember how complement is activated, for example, by classical pathway. Complement involved with formation of membrane attack complex. You remember this chain. C1 is activated, then C4, C2, C3, C5, C6, C7, C8, C9. Here we are interested in the last components in membrane attack complex, C6, C7, C8, C9. It's the final components that are activated. Membrane attack complex destroy antigen. What are antigens in type 2 hypersensitivity? These are mostly cellular elements, cellular components. These are red blood cells. In anaphylactic reaction, in type 1, allergens are mostly proteins, foreign proteins. Food components, maybe foreign serum, or maybe some medical components, antibiotics. In type 2 hypersensitivity, these are cellular components. So reactions most often affect cellular elements in intimate contact with circulating plasma. The most known manifestations, the most famous manifestations of type 2's hypersensitive reaction are mismatching transfusion reactions. Before I explain it, I want to remind you that within human population, we divide four blood groups. Group A, Group B, Group AB, and Group O. How do we classify them? I hope you know it from biology. You should study it in normal physiology. These blood groups are named because of antigens that are present on the surface of red blood cells. Group A have A antigen on the surface of red blood cells. Group B have B antigens on the surface of red blood cells. Group AB have both A and B antigens, and group O have no any antigens on the surface of red blood cells. And in every group, there are also antibodies that circulate in blood plasma. In group A, there are antibodies against B antigen. In group B, there are antibodies against A antigen. In group AB, there are no any antibodies. In group O, there are both antibodies against A and against B. If in transfusion of blood, sometimes in transfusion of the blood, it can cause mismatched transfusion reactions. How does it happen? The red blood cells of the type A, I have just explained it, contain antigen A on the surface, while serum of the type B contain antibodies against type A, antibodies that bind to this antigen. If we transfuse blood from type A to type B patient, type A from donor to type B recipient, it can cause agglutination of donor cells in the recipient, agglutination of donor cells. It is immune complex, antigen and antibody. Antigen and antibody activate C1, C1 activates C4, C4 activates C2, then C3, C5, C6, C7, C8, C9. It is membrane attack complex that cause cytolysis of antigen, cytolysis of transfused red blood cells. It causes hemolysis, destruction of red blood cells, and anemia. Anemia is loss of red blood cells. Because of activation of complement, you can see here, activation of complement and membrane attack complex as a final components that cause lysis, cytolysis. Honestly, we should say that this sort of incorrect transfusion is very rare because of the great care taken by blood banks to ensure a correct match. They control very, very deep blood groups of donor and recipients. But it may occur. Another type of clinical manifestation of type cytotoxic type, it's hemolytic disease of newborn, or erythroblastosis fetalis. Firstly, I want to explain you what is it, then I will show you the picture. Hemolytic disease of newborn is also caused by destruction of or disruption of red blood cells of baby. What happens in the first pregnancy? If rhesus negative, firstly, rhesus, what is it? In a previous lecture, we talked about antigens of human organism. We have, everyone from us has ABO, antigen on the surface of red blood cells, and rhesus antigen. It's also present in membrane of red blood cells. About 85% of all people in the world are rhesus positive. We have this antigen. Other 80% they are all rhesus negative. They don't have this antigen on the surface of red blood cells. So, in the first pregnancy, rhesus negative mother with rhesus positive fetus makes antibodies against baby red blood cells that enter mom's circulation at birth. In the first pregnancy, there are no any clinical symptoms. It doesn't cause hemolytic disease of newborn, doesn't cause any problems. But in every the following pregnancy, antibodies cross placenta binds to red blood cells, activate complement, membrane attack complex, and destroy fetal red blood cells. It causes jaundice and brain damage. Treatment of hemolytic disease newborn includes anti-inflammatory drugs and immunosuppressive agents. Actually, it can be diagnosed. It can be diagnosed by detection of anti-rhesus antibodies. Let's look at this diagram. It is a rhesus positive father, husband, who has rhesus antigen on red blood cells. It's rhesus negative mother. So, hemolytic disease of newborn may occur just in a woman who is rhesus negative. If her fetus is rhesus positive, mother's immune system doesn't know this antigen. Mother's immune system doesn't know rhesus antigen. So in the first pregnancy, mother's immune system produce antibodies that circulate in the bloodstream. And the first pregnancy is not accompanied with hemolytic disease of newborn, it's just sensitization. It causes sensitization, production of antibodies. In every the following pregnancy, antibodies cross the placenta, binds to antigens or allergens. It's red blood cells. These are red blood cells of the fetus. Activate mother's complement. You remember that complement may cross through placenta and it causes lysis of red blood cells of the baby. The another type of immediate hypersensitivity is type 3. It is called immune complex type. Immune complex hypersensitivity involves reaction against soluble antigens circulating in serum. Soluble antigens. What is mechanism? IgA bind with allergen in blood. It forms immune complexes. You remember, antibody binds to antigen and it is called immune complex. Immune complexes are deposited in organs, in internal organs and tissues. For example, in the lungs, kidneys, and on the walls of blood vessels. And you remember about complement. If immune complexes are present in our organism, what is activated? Yes, it's right. Complement is activated. So classical pathway of complement activation develops. And we have said about complement activation in the previous one in cytotoxic. The most important role is in cytolysis by membrane attack complex. But you remember another functions, another action of complement. You remember that during complement activation, C3A and C5A are activated and they cause inflammation. So, in immune complex hypersensitivity in type 3, main role is not in membrane attack complex, but in C3A, C5A. Activation of complement causes activation of C3A, C5A. These are inflammatory components. They cause damage of organs and tissues, produce damage, and they where they are localized. If they localize within blood vessels, within blood vessel walls, or when trapped in filtering structures in kidneys. So it causes inflammation. Let's look at these diagrams, and let's talk about scheme of immune complex hypersensitivity once more. This is blood vessel. It is allergen that enters into the blood vessels. Allergen activates B cells. B cells produce antibodies. Antibodies are bound to allergens, and it form immune complexes or antigen antibody complexes. They are deposited on the walls of blood vessels. Then the presence of immune complexes activates complement activation. Complement activation like C3A, C5A that produce cytokines, pro-inflammatory cytokines. Let's look at this scheme in the last stage. Immune cells, basophils and mast cells produce pro-inflammatory neutrophils, produce pro-inflammatory cytokines, and it causes inflammation in the site of deposition of immune complexes. It caused damage, disruption, damage of tissues. In this case, necrosis of blood vessels. What are clinical manifestations of type 3 hypersensitivity? It includes such diseases as Artamonova reaction and serum sickness. What is Artamonova reaction? It is localized dermal injury due to inflamed blood vessels in the site of any injected antigen. It mostly occurs after injection of foreign serum. Serum sickness is systemic injury initiated by antigen antibody complexes that circulate in the blood and settle into membranes at various sites. Systemic means when immune complexes may be deposited in any internal organ. For example, if immune complexes are deposited in kidneys, it causes glomerulonephritis. If they are deposited in joints, it causes arthritis, inflammation of joints. Another manifestation, another disease that develops because of type 3 hypersensitivity is called farmer's lung. Farmer's lung is hypersensitivity pneumonia induced by the inhalation of allergen coming from hay dust or other agricultural products that are inhaled by the person who contacts with it very, very often. For example, farmers. This hay dust are allergen. It also includes pollen of grass. They bind to antibodies and form immune complexes and deposited in the lungs. So we can see in this picture, in the left lung, it causes a severe, massive inflammation of the lungs. It is not infectious, non-infectious. It is caused by immune complex hypersensitivity. Treatment of immune complex hypersensitivity includes using of anti-inflammatory agents. So we have just said about immediate hypersensitivity. Immediate hypersensitivity that includes three types. Type 1, anaphylaxis. Type 2, cytotoxic. Type 3, immune complex hypersensitivity. Now let's talk about delayed type of hypersensitivity, or type 4. It is also called cell-mediated hypersensitivity. Cell-mediated reactions involve reactions by T cells or T memory cells. They are also called T delayed type hypersensitivity memory cells. Originally, they are T helpers, T helpers memory cells. We know about B memory cells. There are also T helpers memory cells. In the first contact with allergen cause sensitization of person. They cause production of T delayed type hypersensitivity cells. Subsequent contact elicits a reaction, and we can see clinical manifestations. Cell-mediated reactions are delayed by 1 or more days. That's why it is called delayed type of hypersensitivity. Reactions are frequently displayed on the skin: itching, redness, swelling, and pain. Delayed or cell-mediated reactions occur in tuberculosis skin test because of hypersensitivity to Mycobacterium tuberculosis, and that's why it can be used in diagnosis, you remember. In frequent skin contact with metals like nickel or chromium, frequent skin contact with these metals cause delayed hypersensitivity, or long contact with latex also cause cell-mediated reactions. It's about 3% of health care workers who wears latex gloves when they work. What about mechanism of hypersensitivity type 4? The first stage is sensitization phase. It occurs after the first contact with allergen, after metal or Mycobacterium tuberculosis. We know it causes delayed hypersensitivity. Allergen enters in tissues and activate T helper memory cells, T helper cells. You remember that T helpers includes Th1, Th2. In hypersensitivity type 4, Th1 takes part, so sensitized Th1 circulate in the bloodstream of the patient. They are sensitized by this allergen. The next stage is the effector stage or effector phase, when immune system, when human organism contacts with this allergen, with the same allergen at the second time. Sensitized T helper cells, Th1, recognize this allergen and secrete cytokines, pro-inflammatory cytokines, for example, interferon gamma and tumor necrosis factor. Interferon gamma activates macrophages. Activated macrophages secrete mediators that stimulate a strong local inflammatory reaction in the site of allergen injection. Cytotoxic T cells are also activated by Th1, you remember, CD8 cells. They directly kill cells of human tissues and damage the skin. Fluid-filled blisters result. Let's look at this scheme. Type 4 hypersensitivity. Chemical antigens. These are allergens. What can be allergens in type 4? It can be metals, some nickel, chromium, for example, or latex. Or it can be tuberculin. Tuberculin, it's also allergen which injection cause type 4 hypersensitivity. So, allergen enters the human organism, human bloodstream, where there is immune response and activation of dendritic cells or macrophages and sensitization of memory T helper cells, TH cells or T delayed type hypersensitivity. They circulate in the bloodstream. When allergen enters the human organism once more, TH1 recognize this allergen. You can see the dendritic cells present this antigen to T helpers. TH1 produce pro-inflammatory cytokines like tumor necrosis factor and interferon. They activate macrophages. Macrophages move to the site of allergen injection and cause strong inflammatory process here. Cytotoxic T cells that are CD8 cells or T killers, they destroy cells of skin tissues, cause disruption, and we can see inflammation, redness, formation of papule and blisters in the site of allergen injection. So you can see these are clinical manifestation of contact dermatitis from poison oak. These are blisters that are filled with a fluid that are manifested because of strong inflammation caused by macrophages and cytotoxic T cells. How to diagnose type 4 hypersensitivity? We can detect it with skin test. For example, classic example of it is tuberculosis skin test or skin allergic test. We inject tuberculin, and after 24 hours, after 2 days, we can see lump or blister redness that is more than 10-11 millimeters. You have learned it in microbiology, skin allergic test. It is positive if in the human organism there are bacteria, Mycobacterium tuberculosis. Because human organism, human immune system of the patient with Mycobacterium tuberculosis develops hypersensitivity to components of bacterial cell wall and produced tuberculin. Lepromine injection also used in leprosy for diagnosis. So its mechanism of lepromine skin tests is based on delayed hypersensitivity reaction. Let's talk about allergens. So allergen, it is antigen that cause allergy. All allergens can be divided into 2 big groups. It's infections, allergens like bacterial, fungus or viral. When the immune system of the patient develops sensitivity or sensitization to components of bacterial cells to their produced toxins, to components of fungal cells, they are very allergic, or viral envelopes. Uninfectious allergens are most frequent, and they include home dust, pollen allergens, pollen of such plants and trees like birch, alder, willow, poplar, maple. So people who have pollen allergy, they life become very terrible in spring. When pollen is produced in large amount by plants. Food allergy is also very often. And which food products cause allergy? In most cases, milk, eggs, fish, oranges, nuts, industrial components also cause allergies. Washing powder, soap, or chlorines. Medical things cause allergies. These are antibiotics. In this scheme, you can see different types of allergens. Food allergens, these are almost all corns. Insect biting of bee, for example. Most patients have allergy to biting of bee. Latex, pollen of plants. Some patients have allergy to pets, to the fur, especially in cats and in dogs. Drug allergy to antibiotics, for example. Mold allergy to spores of fungi. Gluten allergy to the food that is present in bread, for example, in nuts. Infection allergy. It is allergic state developed after the contact with infectious allergen microorganisms, accompanies infectious process and participates in pathogenesis of the disease. Infectious diseases which are accompanied by a delayed type hypersensitivity reaction includes chronic bacterial infections, viral infections, mycosis infections, invasions by protozoan. And infectious allergy develops against toxins of microorganisms or components of their bacterial cell walls. It has a great diagnostic importance in skin testing, in skin allergic tests like tuberculin testing in tuberculosis. The another type of allergy is drug allergy. In drug allergy, all four types of hypersensitivity reaction could be involved: type 1, type 2, 3, or 4. In most cases, it includes anaphylactic allergy type 1, in most cases. Anaphylactic reactions develops to such antibiotics as penicillin, sulfa drugs, and tetracycline, and to analgesics like codeine and non-steroidal anti-inflammatory drugs. So you must remember about it. If you inject antibiotics or analgesics to your patient, you must observe your patient during some time after injection, during injection and during after some time. Because while you walk, for example, at hospital, your patient may die. You remember that anaphylaxis develops during some minutes. And you can see, if you can see the first clinical symptoms of anaphylaxis, what are these symptoms? A rash, urticaria, a bronchial spasm, you must stop injection of this drug. Stop injection and inject antihistamine drugs and adrenaline or corticosteroid drugs if it's necessary. The immune response in drug allergy is developed towards HAP10 in combination with protein carrier and allergen. You remember that drugs, that antibiotics are HAP10s. HAP10s are incomplete antigen. Incomplete antigen must be bound with protein carrier in human organism. Protein carrier is produced in patient's organism when drug, it is HAP10 drug, is injected. It become allergen and cause anaphylaxis. Symptoms of drug allergy can include, but are not limited, the following list. It includes hives, itching, rash, facial swelling, bronchial spasm, shortness of breath due to the short-term constriction of lung airways, cardiac symptoms such as chest pain, shortness of breath, fatigue, chest palpitation, and light-headedness. How to diagnose allergy? Diagnosis of allergic reaction is based on its mechanism. Type 1 of allergic reaction is mediated by Ige, so we can use skin test. I have said about it. We should observe results of allergic reaction after 20 minutes when we drop allergens on the skin, or we can reveal Ige in the blood. Type 2 of allergic reactions includes revealing of IgG or IgM synthesized against blood cells. It is a cytotoxic. You remember that in this type of allergy, IgM, IgG circulate. IgM or IgG that are synthesized by blood cells, by foreign blood cells, not by self ones. Type 3 is a cytotoxic that are mediated by immune complexes. So we should reveal circulating immune complexes in the blood stream of the patient. And type 4, that is delayed, we can use skin test, but results are visible after 1 or 2 days, after 24 or 48 hours. And we may reveal sensitized T cells and macrophages in vitro, in lab tests. The another type of immune response of human organism is immunological memory. Once more, hypersensitivity or allergy is abnormal type. Immunological memory is normal type of immune response. Immunological memory, it is ability of immune system to remember antigens and mount an immunological response of greater magnitude and with faster kinetics upon recounter of the same antigens. It means that immune system remembers this antigen, and the next time, the following time with contact with the same antigen, immune system will produce more severe immune response, and it will faster. It spreads both to the humoral and cellular immunity and is caused by T and B lymphocytes. It is formed always and exists for years and even decades more. Due to it, our body is protected from repeated antigenic penetration. So it provides lifelong immunity. It provides lifelong immunity after diseases, after some diseases, or after vaccine injection. Mechanisms of immunological memory. The first one, immunological memory is formed because of prolonged presence of the antigen in the body. For example, persistent measles, poliomyelitis, varicella, and some other pathogens for a long time, sometimes all the life, can persist in the body, supporting the immune system in tension. The second mechanism includes differentiation of lymphocytes into memory cells. These cells, these are B cells or T cells. These cells are highly specific to antigenic determinant and can recirculate it in the body during long time, up to 10 years or more. They are distributed in tissues and organs, but are constantly returned to their places of origin. This provides constant readiness of the immune system to react to repeated contact with the antigen by the secondary type. There are some pluses and minuses, or advantages and disadvantages of immunological memory. What are positive sides of immunological memory? Immunological memory is widely used in the practice of vaccinating people to create active immunity. This is done by times vaccination in the case of primary vaccination and with periodic repeated injection of the vaccine preparation. It is called revaccination. So, vaccination of people provides immunity because of formation of memory cells. But there are disadvantages of immunological memory. For example, repeated attempt to transplant once already injected tissue causes a rapid and violent reaction, a rejection crisis. In transplantation, if we transplant the same tissue or organ once more, every the following time it causes more severe graft rejection, because transplanted organ or tissue is antigen. The another type of immune response is immunological tolerance. Immunological tolerance is absence of the immune response to the inoculation of the certain antigens. It is a full unresponsiveness of immune system to the allergen, to the antigen. There are two types of immunological tolerance. It is natural and artificial. Natural or self-tolerance. This is a failure or good thing to attack the body's own proteins and other antigens. When immune system has tolerance to our self-antigens, to our rhesus antigen or AB0 antigen, CD antigen. But if the immune system responds to self, autoimmune disease may result when immune system recognizes our self cells as antigens. It causes autoimmune diseases. These are very serious diseases. They are very badly treated, very severe, very difficult to treat. Induced tolerance is a tolerance to external antigens. We can induce tolerance in a human organism by some methods. In exposure of antigen in embryonic period, it was shown in experiment with mice when the same allergen was exposed to the fetus of the mice in embryonic period, and when after the birth, these mice had tolerance to this antigen. In injection of immunosuppressors that inhibit immune response, we can induce it. And in antigenic mimicry, it is similarity of some human and bacterial antigens. Antigenic mimicry, it is the state when bacteria have the same antigens with a human. For example, it's observed in Streptococcus pyogenes that cause sore throat. Antigen of this M protein of this bacteria is similar to antigens of kidney, glomerulus, and heart. So immune system doesn't recognize Streptococcus as foreign. Immune system thinks that it is our self cells. Mechanisms of tolerance. There are three most likely causes of the development of immunological tolerance. The first one is elimination or death of antigen-specific lymphocytes from the body. The second one is blockade of biological activity of immune-competent cells. And the third one is rapid antigen neutralization with antibodies. How can we use immunological tolerance in medical practice? Immunological tolerance has great practical importance. It is used to solve many important problems of medicine, such as organ and tissue transplantation, because we want to transplant, if we want to transplant organs or tissue, immune system should recognize these organs and tissues as their selves. The second, in suppression of autoimmune reactions, autoimmune diseases, and the third one, in treatment of allergies and other pathological conditions associated with aggressive behavior of the immune system. That's all. Thanks for your attention. Prepare this lecture for the next immunology class. Goodbye. Take care of